I want to go back on something that you said, Dr. Ryan. You said that 80% of all antidepressants in the country are prescribed by family care physicians. One of the things that I have always been concerned about, and I'm not sure that it's changing now, is that while medication is important, we were talking about brain chemicals earlier, therapy is important too for some people, particularly people who've struggled with mental illness for a long time and have developed all sorts of dysfunctional coping mechanisms that have to be undone. How easy is it to actually move a patient into therapy? I mean, I look at my situation, psychiatrists don't even see patients anymore. They manage the prescription work of various MSWs and whatever. Are there people, I see, Danielle, you say you see people for brief therapy. Mm-hmm. Is there therapy out there? Can people access it? Our insurance coverage actually providing for that? What's the status of therapy these days, and how does that fit into your integrated health model?
You want me to talk?
Well, so you'll get a family doctor's version of that. You know, the insurance is, it's, you guys know the golden rules in healthcare, right? Hugh has the gold, makes the rules. And so the insurers and the government have the gold, so you follow their rules. So, they'll set limits. I don't know them, you may know them, but each insurance will have a limit on how much therapy they'll pay for. And then if you're uninsured, then you're looking for someone that'll do it on a sliding fee scale. There's a few around, and again, you're generally going to get in the queue for that. And Medicaid, again, I think we have resources in our county, but I think a lot of it's insurance driven and how rapidly you can access that. I can tell you in primary care, we basically do sort of supportive therapy. It's like being, patting people on the back. I mean, it's really just sort of support, and then, refer out for really any sort of deeper therapy. I think at least most of the data I've seen is that people who are moderately, severely affected can really benefit from talk therapy. Milder anxiety, milder depression, I think the data is not as clear. And then the insurance companies limit that, frankly, because the drugs are cheaper than therapy, right? You can get antidepressants for $4 a month, $10 for 3 months. So that's really what's happened, and why they've shifted their amount they'll pay for down.
Right, but we're still left with the question, which is, Danielle or Phil, you have someone who clearly needs talk therapy. What are your options there? If the answer is the health insurance folks are going to keep them out, the Medicaid people are going to keep them out, I mean, isn't that a huge gap in our integrative system?
For me, it's very hard. I mean, I agree with Ray, but there are a lot of people, no matter who want therapy.
Right.
And to find them, I mean, it doesn't matter who I refer them to. It's very hard to get in, mainly because when they come, they can't get in, or they have a long wait. It's the same with us. I mean, they're just not accessible, or they can't afford it. It usually comes down to one of those two things. Maybe, we have a social worker too, and she's good, but she can only do so much. And she can only, with us, 12 hours a week. Because she go, like you said, she goes between different clinics. So I have a problem finding that.